What we wanted to look at in this study that was funded by our partners at NRDC was how varied bill levels are for a basic level of consumption, 4,000 gallons, across 4 different states and 4 different regions of the US: Georgia, Arizona, New Hampshire, and Wisconsin. What we found, which really builds on previous work we'd done, bill levels are really varied, even in local areas. While the average, even across states, is actually quite similar, you see people paying anywhere, for instance, I think in the Atlanta metro area, between $5 and $200 for the same amount of water, 4,000 gallons. So there's a lot of inequities in what people pay for the same amount of water, even between their neighbors. We also looked at what's driving some of this variation and found a lot of it has to do with system size, with rate structure, as well as ownership. And what I want to be very clear about is we're not saying that systems should be charging the exact same, or even necessarily really similarly for the same amount of water. But what we are saying is that what people are paying, need to pay for a modest amount of water should be fairly similar, especially in neighboring areas. And we think our study has implications for policy, and that there should be oversight, as we see in Wisconsin, where we also see less variation in local bills. There should be potential oversight by the state, particularly for small systems that charge really high rates. There should be targeted affordability support, like we see from some systems, from some states, and increasingly from the federal government. And then in some cases, really high or really low bill levels potentially should be considered as informing consolidation efforts. What we wanted to look at